thank you, Angie, for that introduction, and just to say what a pleasure and an honour it is to share the platform with Francis, Dave, Emily, Beverly, Maura and Angie today, as people who really do care about our NHS, as people who work in our NHS, and are showing today the unity of purpose of all of us in defending our National Health Service. Before I became an MP, I was working with National Health Service employees. I was an officer of the National Union of Public Employees, which is now part of Unison. And what it taught me was that incredible spirit of team there is in every hospital, of porters, cleaners, nurses, doctors, admin workers, security staff, everybody else who works so hard in it. And those members of my union and all the other unions, they came from all over the world. They came from all parts of this country, all parts of Europe, and indeed all parts of the world. And they have this incredible determination to deliver a health service free at the point of use for everybody. On the 23rd of June, we've got a very big decision to make. I value our NHS and the dedication of its staff. I would not be voting for Remain if I thought there was any risk whatsoever to our National Health Service. We're here today to say what the risk is if we leave on the 23rd of June. The NHS, our National Health Service, is Labour's proudest creation. It was brought into law in 1948 by a man with real vision, Aaron Bevan, by a government with real vision about providing a reasonable and good service for everybody. Healthcare as a human right, not a privilege to be paid for, which is what happened before. And it's lasted all these years because people love it and value it. But there is a crisis in the NHS, a crisis of the making of the Tory government. The NHS is now in record deficit. What's damaged the NHS is the top-down reorganisation that was imposed by this government, having said they would never do that, and then, on top of that, the insufficient funding of so many of our services. There isn't time to give you all the examples, but I'll give you just a few. They've cut mental health budgets, despite the mental health crisis that exists in this country, despite the high levels of suicides, particularly amongst young men. They've cut nurses and midwives' bursaries. Last week I was in Birmingham as part of the campaign I'm doing in every major city in this country, talking to nurses who were about to graduate. They benefited from the bursary. And I asked them a number of questions, and indeed they asked me a lot of questions as well. I asked them, could they have undertaken this course had there not been a bursary available? Every single one of them said no, they could not have done. We would have lost them, their skills, and all of our population would have been the poorer for the loss of their determination and their skills. And what they said to me was, we want to protect the bursaries for the next generation. They're the real dedicated people in the NHS. This government has also slashed social care for the elderly and disabled, often making it unsafe to discharge patients from hospital, thus causing bed blocking and much greater cost than it would if the adult social care services were universally and properly available. They've also been opening up the NHS to be used by more and more private patients under the Health and Social Care Act. And they picked this awful fight with the junior doctors, which they eventually had to negotiate with them to try to come to some agreement. Those are just some examples of cuts that have taken place in the NHS. All the while, this government has been cutting taxes for the super rich, cutting taxes for big corporations, and doing precious little to close down tax havens where that money is siphoned away from this country that ought to be spent on our public services. The crisis would have been even worse if many on the Leave side had had their way. There are people leading that campaign who have argued against the NHS and free healthcare on demand as a principle. As Francis and Dave have pointed out, the same people have the audacity to now portray themselves as saviours of the NHS. Many of them don't even want there to be a National Health Service. Aaron Banks, the millionaire funder of the Leave side, said, and I quote, "If it were up to me, I'd privatise the NHS." Nigel Farage, as Francis pointed out, called for an insurance-based system to replace the NHS, ending the universal principle. Michael Gove, co-author of a book that says the NHS is no longer relevant in the 21st century, a book which calls upon the NHS to be replaced by a new system of health provision in which people would pay money into individual health accounts. Imagine the inequalities that would come as a result of that. Imagine those who couldn't afford to pay the money into an individual account compared to those who could. He doesn't understand. The principle is that it's there for everyone, equally, when they need it. And it's there for all of us to pay for it because we can afford to or we cannot afford to, but we pay into it in proportion to our income. He doesn't understand that simple, basic decency principle. And Boris Johnson, who said, if people have to pay for NHS services, they will value it more. Really? Really? I meet people every day who use the NHS. Some are very poor. Some are homeless. Some are better off. They all equally value the dedication and the way they're treated equally by all the NHS staff. Thank you to all of you.